Welcome, everyone. We are happy to have you again. We've finally come to the end of this hackathon, and it's been an intense 48 hours for all of the teams, but everyone created fantastic solutions. First of all, let me thank our sponsors and our partners who made this hackathon possible. Let me start by introducing the challenge provider sponsors. Gedeon Richter is one of the most important pharmaceutical companies in Hungary. It's built on innovation, and their main goal is to help the public treat illnesses with innovative products. With an R&D base that employs more than 1,200 people, it is the most important pharmaceutical research center in Central Eastern Europe. Gedeon Richter provided a challenge to help gain users' trust with a straightforward opt-in process and improved privacy of e-health data. Janssen is the pharmaceutical companies of Johnson & Johnson. They work tirelessly to help patients everywhere by fighting sickness with science. They focus on areas like immunology, infectious diseases, and vaccines. Janssen Hungary, in collaboration with the COVID Vaccination Center, was looking for an innovative digital solution to streamline COVID-19 vaccination and to improve patient experience. MSD is a subsidiary of the American Merck & Co. Their parent company is a leading research-oriented pharmaceutical company that develops, manufactures, and markets innovative medicine. In 2019, they spent $9.9 billion on research and development. And MSD wanted an online platform to help individuals understand the importance of early screening and to help them get conveniently screened by the state healthcare system. And we have other partners as well, as you can see. Doctor24 is one of Hungary's leading private healthcare providers. Doctor24 has now 6 occupational health centers and an outpatient clinic. Evosoft is engaged in various fields of activities, including but not limited to medical software development, industrial automation, and industrial system testing. Through their experience of over 25 years, the company has evolved into Hungary's leading software house. We would also like to thank our 6 incubation partners and industry advisors. And let's follow with some statistics. Hack&Heal in numbers. We had more than 200 registrations, 26 teams competed in the challenge, 31 mentors were helping us, and we had a total of 85 mentoring sessions. The different challenges had 13 projects for the MSD challenge, 5 for the challenge provided by Janssen, and 7 to the challenge of Gedeon Richter. We had wonderful mentors, and we would like to thank them for their persistent help. And with that said, let's look at the challenge winners. Solid Data won the challenge provided by Gedeon Richter, and I would love to show you their video.
A huge problem for pharmaceutical companies working with health data is how to access the user's sensitive data without storing it in a cloud, but running algorithms on the data that enhances the user experience. Our solution is a data flow model, which is decentralized and encrypted, but on the other hand, third party has the ability to refine how the app works with a new algorithm that can even perform statistical data analysis while keeping all sensitive data compliant with GDPR. GDPR regulations. This strengthens the user's confidence in the application. The method uses a federated learning algorithm to achieve decentralization where there are only models on the user's phone. After learning, they are sent to the server in the form of data slices using multi-party computation. We create a new model from the models using aggregation AI, and this is fed back to the users in the form of an update. In this method, the model uses logistic regression, which is taught using a gradient descent learning algorithm, so the user can get more accurate feedback with each update. We have also approached the challenge from a medical perspective. We noticed the issue that not only menstruation and ovulational cycle can modify the measured core temperature inside the scabbard, but there are additional influencing factors. After consulting with professional gynecologists and genetists, Dr. László Molnár and Professor Dr. Ferenc Banhidi, we evaluated the problem and raised an idea. During the pre-ring continuous measurement, the Kindra application will send the user a question form about whether she influences the temperature measurement with additional factors like anti-inflammatory drugs, fever, doing sports, or alcohol consuming. This would help the learning algorithm to continuously learn from real data and could not be influenced with wrong information to mispredict the fertilization window. Measurements, like how a treatment pill influences the temperature, can be stored for additional use. Solidata is looking forward to help women raise their chance for pregnancy.
And with that said, we also had a winner for the challenge provided by Janssen Hungary. Their name is Patient, and we would love to show you their video as well.
COVID-19 has changed our everyday life. People all around the world are fighting the effect of the pandemic. To restart our life, vaccinating a large population is the most effective solution right now. However, the complex and outdated vaccination organizing system can lead us to more wasted time, valuable vaccines, and patience. That empowering healthcare professionals to do the vaccination process effectively and easily understandable by the patient is the key to streamline COVID-19 vaccination process. Service consists of expandable models. With our solutions, patients will be prepared for and guided along the vaccination process. Healthcare professionals' administrative burden will be reduced in a way that the possibility of data loss or data entry errors are minimized. The development process consists of 3 consecutive phases. First, we launch our MVP with the aim of enhancing patient journey experience by creating one-way communication-based digital solution. MVP is a responsive, informative, user-friendly gamified website. The site allows the user to get relevant information from one source about the overall process. Additionally, it's a personal vaccination journey tracking list. Make available an online field-name, printable and portable consent form. A QR code can be generated from it, which later can be implemented into both the hospital and the EEST system. Phase 2, we will be able to connect patient and the vaccination center prior to the vaccination day and even after the vaccination. Third phase, we develop our database service models. We release our MVP in 2 months, phase 2 ends in 6 months, and we introduce phase 3 in 8 months. Our business model consists of 3 stages. We can have a quick impact on healthcare professionals and patients. With your help, within 1 year, we will be able to provide support in the mass vaccination stage by establishing a connection between the hospital and the patient. This way, we contribute to a better capacity utilization of each vaccination point and a faster overall process.
And Team Medicare won the challenge provided by MSD. Let's watch their video.
Nowadays, many people are trying to lead a healthy lifestyle and prevention of diseases is essential. However, we are unable to find reliable information.
Let's look at Peter, who has focused exclusively on his career for the last 10 years, but his family illnesses have made him wonder how he could prevent these. At Medicare, our mission is to provide the most suitable screening test opportunities for people like Peter. Our goal is to save money, nerves, and life. Our web application offers a user-friendly survey to identify the necessary screening test for Peter. Peter can indicate his health issues through the survey to highlight suitable screening activities. After he accepted his personalized screening suggestions, Peter can register it and search for his general practitioner to send a request asking her opinion about the screening tests. His GP, Helga, gets an email about the request asking to log into her dashboard where she can choose between their patients. On the personal page, she can accept, remove or add new screening tests based on their information. She can also sign whether she uploaded the referral to the public health cloud. Peter also gets an email about the updates by Helga asking to log into his dashboard where he can manage the screening appointments. The system helps to find the designated place of medical service. After that, Peter can update his calendar to get notifications about the upcoming screening activities. To support elderly patients, there's a function to connect younger relatives to the accounts. It will enable notifications about the upcoming events, thus several screening opportunities become available for this group of users. We believe that our web application is beneficial for the whole society. For patients, it offers reliable information and unique digital access for government-funded screening tests. For the general practitioners, it improves efficiency and effectivity of the preventing activities. For the healthcare system, it saves lives and reduces the number of patients who suffer from severe chronic disease, thereby reducing the direct medical expenses.
And as we mentioned before the live pitches, we didn't only have winners by the challenge providers, we also had winners provided by you, the community. So you could vote on each other using the Junction app, and the vaccination helper team won 3rd place. Let's watch their video.
Greetings. My name is Ruben Zsidó, and my teammates are Ádám Kékesi and Balázs Prosek. We are the devs with Insomnia. We've made this presentation to demonstrate how our application could speed up the process of COVID vaccination registration. We found the chance and challenge the most interesting and tried to find a solution to connect the patients with the vaccinating doctor digitally. In our app, patients, doctors, and vaccinating doctors can create their own accounts. The patient will be able to choose their family doctor, who will be acting as a middleman between the vaccinating point and the patient. The patient will be able to request vaccination with their consent form filled out using the application. In the future, this filled out consent form could be downloaded and potentially printed. With that information, the family doctor could request a vaccination date from the nearest vaccinating doctor. It will be the vaccinator's task to decide which type of vaccine the patient could get based on their consent form. The vaccinating doctor would be able to choose possible dates of vaccination by checking their list of scheduled vaccinations. In the vaccination center, a patient could just show a QR code on their phone or a printed version, and it could be decided if the patient is accepted for the vaccination or not. Later, a feature where patients can report their symptoms after vaccination to the family doctor could also be added to the app, as well as an automatic EEST fill-out system. Our team still attends a high school in Győr, and we'd be glad if we could continue working on this project in the future. Thank you for the attention.
And Screen Me came in 2nd place for the community voting. Let's watch their video as well.
In the 21st century, still 500 women die in Hungary every year in cervical cancer alone. And I could be one of them, but I'm not, because I go screening regularly. I like the 88% of the population based on our study. The key is motivation and information. That's why we bring you Screen Me. Screen Me is a brand new platform delivering your personalized screening schedules, sending you reminders, so you never miss a life-saving appointment again. Based on your age, sex, and on medical data, Screen Me plans your recommended screenings in advance. When the scheduled checkup appears, the platform sends you a notification where you can simply book an appointment in the nearest health facility with just 2 clicks. But we did not stop here. What if you could not only take of yourself, but also family and loved ones? Just easily add your family members to your personal group, and Screen Me will remind you about their upcoming recommended screenings as well. Screen Me integrates with e-health systems, so your medical data is available with minimal manual data entry. After the validation by medical and business experts, we developed the technical prototype And in addition, we outlined a launch marketing campaign. Here is our team made up from medical, IT, business, and marketing experts. We are ready to execute. See beyond yourself? Screen me. Your personal medical screening reminder, which also helps you to take care of your loved ones.
And as previously mentioned, and as they gave in to the live pitching, Team Vaxi got the most points by you, the community. Let's watch their video.
COVID-19 vaccinations are a burden to both normal people and the public healthcare sector. For many people, this is the first time in a while they get a vaccination, and it may be hard to tell what side effects are normal and when to call the doctor. Public healthcare, on the other hand, would like to work as efficiently as possible and only spend time on the serious problems the vaccinations may cause. Thirdly, the pharmaceutical companies would like to receive as much data as possible from the vaccinations so that future vaccinations are safer and can be developed faster. To solve these problems, we've developed Vaxi, a patient monitoring application that is easy to use and acts as a digital assessment of the patient's need for medical guidance. Vaxi needs only the basic information, such as age and sex, from the patient to function to its full potential. It reminds the user to fill a quick daily monitoring questionnaire, which allows for a quick intervention. If the patient's condition is such that medical attention is needed, the patient is advised on how to contact a medical professional. In our application, all data gathered is anonymized but can still be used to form important information about the performance and problems of the different vaccines. This data can be easily forwarded to pharmaceutical researchers and companies through our API to make future vaccinations even safer and efficient. Of course, all data gathered complies with GDPR and is handled with state-of-the-art security. Vaxi, post-vaccine comfort.
And they were all the teams who had an opportunity to live pitch at Hack&Heal. Congratulations again to everyone who had a chance to pitch. And now, let me tell you a bit about our incubation offers. By the Hungarian Business Angel Network, the absolute winner will have a chance to participate in the Hungarian Business Angel Network's online pitch event on the 2nd of March, and they will receive a free mentoring session before the event. The Foundation for Sustainable Enterprises offers 60 hours of incubation for 3 months, and they will offer that to a team who had a socially beneficial project. OXO Holdings offered an opportunity to participate in their all-day event. It's a series of workshops on 3 suitable business development topics. Startup Campus offered a free mentoring consultation and an opportunity to participate in the Techstars Startup Weekend Budapest 2021 Spring Idea Competition. High Ventures offered an accelerated entry opportunity into High Ventures Incubation Investment Program, where 15 million forints of startup capital can be raised to start a startup. Accelerated entry means that their investment managers will pay close attention to the team and make sure to invite them to pitch in front of their investment committee. MKB FinTech Lab 1 offered 3 times 90 minutes of tailor-made mentoring from their amazing FinTech Lab team, and 2, potential incubation. Hackathon participants also had the chance to be selected for a 3-month incubation package from FinTech Factory, powered by MKB FinTech Lab. And last but not least, Deep Note. Deep Note allows teams to easily work on data science projects together in real time in one place, and their offer goes to the final winner which is a 1-year free subscription to DeepNote. We will get in touch with the winning teams, so stay tuned for that. And now, the moment we've been all waiting for, the absolute winner. For the voting, we haven't taken into account that many of you have extremely large follower bases, so we made a tough choice of only taking registered participants and partners' registered email addresses into account to count toward the final winner. This way, we assured the professional validity of the final winner of the Hack&Heal hackathon. And now, let me introduce you to the founder of Craft Hub, Medea Bachifava, to reveal who the final winner is.
Hello. Hello, Carolina, and hello, everyone. So, what a weekend. I really enjoyed it, and I'm so happy that I'm the one who is actually revealing who is the absolute winner and who was the most loved team by everyone. So, let's see. The absolute winner is ScreenMe. So, congratulations, ScreenMe, the team who won the €2,500. Congratulations again.
Thank you for
You're welcome.
Thank you for that, and congratulations to ScreenMe.
I leave you here.
All right.
I leave you here, guys. Bye.
And before we leave, I thank everyone. It's been an intense weekend, and every team had fantastic ideas and great execution. Thanks to the staff, thanks to the partners, and thank you to the mentors and to everyone. And let me tell you what comes next. Before we leave for today, we have some great news. Craft Hub is already working on its next hackathon. It's called Craft Hack, and it will be held on the 28th and the 30th of April. We want to make sure that this will be the best event possible. So please fill out our feedback forms that we will share in the chats everywhere. We would love to hear from you and implement your feedback and make Craft Hack awesome. And if you don't want to miss out on participating in this hackathon either, please follow our channels and sign up for Craft Hack and stay tuned. It's been a pleasure to be with you. Have a great evening.